Good evening, and a warm welcome to the talk show on heart health, an initiative by Integrated Health and Wellbeing Council, supported by Manipal Hospitals. I'm Riddhi Lakra, Assistant Editor, IHW.TV. On the occasion of the World Heart Day, we are here gathered to understand what are the various problems of cardiovascular diseases which is occurring in the world, and most importantly in India. A lot of people are still avoiding this fact that heart disease, cardiovascular issues is one of the important things that is also affecting lives of many. Cardiovascular diseases is the world's #1 killer, causing over 18.6 million deaths per year. CVD, also known as cardiovascular disease, is a class of disease that is affected by heart or blood vessels, including the veins and the arteries. More people die from cardiovascular disease worldwide from any other causes. That is almost 18.6 million every year. And out of these deaths, 85% are due to the coronary heart disease and cerebrovascular diseases, that is including the strokes, and which is becoming quite common in India. Cardiovascular diseases has now become the leading cause of mortality in India, with which the increasing number of coronary artery disease, there is also a need to understand the importance of heart health and knowing the options of treatment in the cases of serious issues. To discuss this, we have with us panelists including Dr. Sridhar. Dr. Sridhar Ji, he's a consultant, interventional cardiology, cardiac electrophysiology at the Manipal Hospitals. We also have with us Dr. Rocky Katheria. He's a consultant, interventional cardiology, Manipal Hospitals, Vatu Road. We also have with us Dr. Mukundan Sheshadri. I'm sorry for pronouncing it wrong. He's a consultant, cardiovascular and thoracic surgery at Manipal Hospitals, Whitefield. Joining us another is Dr. Narendra. Dr. Narendra is a consultant, cardiovascular and thoracic surgery at the Manipal Hospitals. I welcome all the speakers for this panel session discussing about a very important issue on heart health. Firstly, I would like to start with Dr. Sridhar. Doctor, to understand, we have been, over the years, we have been seeing a lot of heart issues in India. We often hear news that there is the normal people who are working out in gyms, normal people who are regular workers, film stars who we have heard that they have died of a lot of heart diseases. So what is one of the major reasons here in India? And how do you think, who and all are getting this heart problems? And to basically understand what exactly is a cardiovascular disease?
Yeah, good evening. Basically, what is happening towards heart health, or rather, I would call it as ill health, is multifactorial. It's very difficult to say it as one factor as a factor which is responsible for what we are going through of the horrendous or rather geometric progression of cardiovascular diseases, what we are seeing. In our country, multifactorial can be personal, can be environmental, can be the work-related things like stress, can be food-related, and there can be so many other factors or a combination of all of this. Most important factors, if I have to tell about heart diseases in India, is most of our heart patients are younger. One of the reasons why we might be encountering these younger patients because of heart disease is we are the most populous country with a very huge diabetic population. Diabetes is a very big risk factor for developing cardiovascular disease. And we have been progressing to be the #1 country for the total number of diabetic population. Probably Bangalore is going to be called the diabetic capital of the world very soon, the city where we are living. And diabetes is again, we cannot call it as a disease, it's a syndrome. It is again driven by all the risk factors which are temporarily responsible for heart diseases. For example, what we eat, physical activities, stress, sleep, personality. We call sometimes as type A personality. There is a need to prove yourself, be number one. I mean, be in the forefront of everything what you are doing, trying to be recognized, not only for yourself, you push yourself. I mean, all these thoughts onto your children also, the younger generation, the elder, everybody of us are pushing each other. So that is what is called type A personality. That adds in lot of inbuilt stress. So along with it comes the adrenergic drive in the body. There are a lot of sympathetic hormones which get released. There are oxidative stress which get involved unknowingly. The sugar levels are going to go up. Your metabolic parameters are going to get deranged. You eat a lot to de-stress yourself. I mean, one of the reasons why people eat a lot is depression. This is a very known fact. We push ourselves into a lot of depression driven by anxiety. We eat a lot. We eat a lot of junk food. Family values have also gone. So there is no home cooked food easily available, which comes with a lot of health and wealth. Okay. And the home cooked food comes with affection, which you do not get in fast foods, which contains a lot of oxidative radicals, very, saturated fats, high salt content. So all these things coupled with depression, person becomes dependent on drugs, alcohol, smoking, and you do not have time for exercise. You do not have time for good sleep. You ultimately develop all sorts of diseases, beginning with diabetes, beginning with hypertension. You become obese. I mean, all this obesity, hypertension, diabetes, adrenergic drive is driving the younger population in general and the whole population of India in particular more and more towards cardiovascular disease. This is what is my opinion about, the wealth or the richness of our country as far as cardiovascular disease is concerned.
Doctor, just to add a little bit to your question, I want to ask it again. So what exactly is a cardiovascular disease to understand by a simple people like?
Okay. Cardiovascular disease, it's again a very broad question. See, here there are two entities involved. Cardio is usually referred to the heart. Vascular is the blood circulation of the body. That's what is the vascular system. Vascular system is there everywhere. We have the blood supply system in the brain. We have the blood supply system of the heart. We have the blood supply system to each and every organ in the body. Cardiovascular system are diseases in particular refer to all the diseases pertaining to the blood supply of each individual organs. That's why we call it as cardiovascular disease. It can involve the vascular or the blood supply problems of the brain, which can manifest as stroke. And if it is particularly to be related to heart, it is some problem which develops in the blood supply of the heart itself. It's a paradox that heart, though, is full of blood and pumps itself liters of blood every day, every minute, is not able to utilize the nutrients and the oxygen which is well within blood inside its chambers. God has created a mechanism that this blood has to be fed to the muscles of the heart through tubes. That is the vascular system, which we call it as coronary arteries. As I told in my previous answer, these blood pressure, hypertension, high cholesterol levels make the vascular system diseased. Cholesterol deposits, fat deposits happen inside the blood supply everywhere in the vascular system, manifesting as different entities. If it is happening in the brain, we call it a stroke, paralytic attack, which is a disaster. If it is happening in the blood supply of the legs or the limbs, we result in gangrene and limb loss or toe loss, whatever you call it as. If the blood supply problem in the coronary arteries, blocks are developing due to the cholesterol deposits inside the blood supply of the heart system, the coronary arteries, we call it as coronary artery disease pertaining to the vascular aspect of cardiovascular diseases. So what happens when there is a blood supply block developing in the blood supply of the heart is, initially, when till the time the criticality is reached, the patient is very, very silent. The problems are not at all there, because till the time the demand supply mismatch happens, the symptoms are not at all there. You are as good as anybody else. When once the progression of blocks happens because of the cumulative cholesterol deposits, a point will reach where there is no match of demand supply. So when you do physical activities where your heart has to work more, or in stressful situations where the energy need of the heart is high, that much of blood supply which is needed by the heart muscle to take away the oxygen nutrients out of the blood is not there because of the mismatched perfusion. That's when you start developing symptoms of chest pain or breathlessness or on walking, etc., etc. In addition to this, another disaster can happen over these cholesterol blocks. Sometimes, unfortunately, especially slow in smokers or in those people who are doing severe physical activities, trainees, athleticism or gym or whatever, what we call it as plaque rupture can happen. There is a cholesterol deposit over which there is a smooth lining which is there in all the blood vessels. This lining gets interrupted. We call it as endothelial disruption, or otherwise called plaque disruption, which precipitates sudden blood clot over these cholesterol deposits. For example, if the cholesterol block is to the tune of 60-70%, where the person is not having any symptoms, one fine day the plaque rupture happens, and over this 60% block, some blood clot will form, completely shutting off one part of blood supply to the heart. We generally call this as heart attack as a layman term, or a myocardial infarction in the clinical terms, where that area of the heart which is supplied by this tube, the coronary arteries, suddenly shuts off, resulting in the death of the heart muscle. That's what is the heart attack. So it can manifest in different ways in the form of chest pain. You may reach the hospital in time and get procedures done. And one of the other reasons, if you at the same time get the block, identify the block, you undergo angioplasties, or if multiple blocks are there, there is bypass surgery. But the most important disaster that can happen is what is called sudden cardiac death in heart attack situations. When the heart suddenly gets shuts off with the blood supply, the muscle starts dying, the heart rhythm becomes abnormal. We call it as ventricular tachycardia or ventricular fibrillation, where heart starts beating tremendously fast. That can result in an entity called sudden cardiac death. Most of the deaths which happen in heart attack is predominantly due to an entity called sudden cardiac death, where the patient is not even able to reach the hospital. And more unfortunately, this type of manifestation of heart attack in the form of sudden cardiac death is very high in younger individuals. That is adding salt to the wound. So this is what is happening because of the various risk factors which is cumulatively continuously happening in our society, in our country, which is resulting in the exodus of cardiovascular diseases and sudden cardiac deaths.
Thank you, Dr. Sridhara. You have spoken a lot of points here, which we would be discussing it further as well. Coming to Dr. Rocky, as doctor was talking about the lifestyle disorders. So our cardiovascular disease is a lifestyle disorder essentially, and our all these other factors. What are the other factors which is actually leading? He has mentioned some, but if you could also tell. And there's another point that ethnicity. Do Indians are much prone to heart diseases or because of our lifestyle? If you could tell, comment on this.
So, as Dr. Sridhar has already pointed out, many risk factors which contributes to a heart issues. Usually, we divide those risk factors into a modifiable and non-modifiable, and something which we can do, something which is there in our hand. Non-modifiable risk factors, age is one of the most common. Aging is a process where day in and out you keep aging, and the risk always increases. Okay. Other risk factor is gender. Males, when you compared to females, they're at higher risk of having a heart issues. But that doesn't mean that this lasts throughout. Females, after postmenopausal phase, they also start having the risk of having a heart issues. So they are protected only during this phase when the menopause is attained. Till that age, they are protected. After that, their risk equalizes like a male. Third risk factors being a family history. Suppose if someone in your family has a heart issues, which is around, suppose your father or brother has a heart issues less than 55 years of age. So you are at least 3 times at higher risk of having a heart issues. Then another questions you have asked is ethnicity. Yes, definitely. Asians, blacks, they are at higher risk of having a heart issues. Some of the studies have found out that our coronary arteries tends to be smaller in diameter compared to the Western population. So we are slightly higher risk compared to those Western population. And already Dr. Sridhar has discussed diabetes. We are the capital now, and Bangalore is going to be, I mean, every second person is diabetic now. So diabetes is a major risk factor, which all contributes to having a heart-related issues. So these were some of the non-modifiable risks. Some of the modifiable risk is obviously our lifestyle habits, the way we eat, the way we work out, no physical activity at all, too much of stress. Our food habits, more of high carbohydrate food, more of fatty food, carbonated drinks, energy drinks. All these things contribute to long-term having a heart issues. In a young population, when we see that young people are also coming with a heart attack, smoking is one of the most common risk factor. We see at least three patient who has a heart attack, one will be a smoker. Smoking tends to cause blood to clot formation. So they did not have any blockages, they did not have any cholesterol deposit in the arteries. Their arteries may be as clean as anyone else. But this smoking can cause blood to form clot. This clot can obstruct the arteries and form the heart attack. So these are some of the modifiable risk factors which we should take care, apart from the non-modifiable where we don't have much role to play.
Thank you, Dr. Rocky. Dr. Mukundan, I want to come to you. Like to understand, like heart disease is not something that which is commonly observed. Like people do not know what is happening inside them. So, what would be the various symptoms one can observe when one is like already having some symptoms, like for the coronary artery diseases, any sort of? What is the starting point? Is that a younger age or it is an old age when people actually should start taking care of themselves and their hearts? Doctor, you're on mute.
Sorry. So what I would say is, let's look at the typical symptoms of heart disease, and then we'll come to, what is happening nowadays in the younger population and what we should do. So the typical symptom is what, is chest pain. And there's no doubt that, this is angina, what we call. And it is important to try and find out that, because it could be typical or atypical, that is it a cardiac type of chest pain or a non-cardiac type of chest pain is the first thing we should try to elucidate when a patient comes to you. So what we say is very typical chest pain on the left side of the chest, sometimes going to the left arm, sometimes going to the jaw, sometimes going to the back. So the pain is not necessarily only over the left side of the chest, as most people think. It can present in multiple ways. But what is important is to try and see how it presents. Is this pain related typically to exertion? There's somebody who says that, I was all right walking about 3 kilometers a day. And now I find that even when I walk 2 kilometers, I start getting a left arm pain. I stop for some time, the pain goes away, and I'm able to again walk for another 2 kilometers or 1 kilometer. So they assume that, there's sometimes it's just a bit of tiredness or a bit of the normal thing to have it. But we pick up those things very quickly and we say that, suppose you could actually walk normally 3 kilometers, now you're able to walk only 2 kilometers or to walk only 1 kilometer, and the pain typically comes on and it goes away on rest. This is what we call classical angina. It could be, typically it could go to the left arm, left side of the chest, back, jaw. Some people, in fact, many people present to the dentist and have typical pain in the jaw. And the dentist says there's nothing wrong with your teeth. And then if a careful, inquiry reveals that this jaw pain comes across only when they exert themselves. They climb a flight of stairs, which previously nothing happened, and now they're getting chest pain or angina. So, we use the word chest pain, but we actually mean is called the word angina. So we need to really be clear about that. And when someone comes with that history, we have a high index of suspicion that he may be having a blockage in his coronary arteries. The other typical presentation is shortness of breath. Some people don't have this typical angina. Angina is a sensation of something pressing on your chest, or as if, they describe that you keep a heavy object on your chest, as if somebody is standing on your chest. That is very typical of angina. Some people don't present with this type of pain, but they present only with little shortness of breath. And they say that, when you walk, I used to walk, say, about 1 kilometer every day, but now I'm not able to do that. I get breathless when I walk. And that is again very typical that, you stop for some time, it goes away. And now this is important for us to try and elucidate. Now, especially in our country with diabetes, which is so high, which is so rampant, and diabetes has got, a propensity to affect the nerves, so called a neuropathy. So they don't get the typical pain. So they often present with tiredness, with some amount of shortness of breath. Sometimes it's just an alteration of their sugar control. There's many things. You need a high index of suspicion, especially in a diabetic, to try and find out, is this a cardiac or non-cardiac? What age? Now, age, we have seen recently a lot of young people coming, and in fact, we are seeing that in the past, it used to be the fathers and the children bringing the parents. Now we are seeing the parents bringing their children for heart problems. So definitely the age has come down, and that is probably related to our lifestyle. So everything is convenient now. So even post-COVID, we don't even have to step out of the house, and everything is delivered to us. Even whatever exertion we're going to do, walking we're going to do, we are finding excuses not to do it. And so the lifestyle things have changed. So we are seeing in younger people. So our advice is that anybody over the age of 40 should at least start having once, a complete cardiac evaluation. And then based on any risk factors, there may be more periodic or less periodic evaluation. You may want to do it once in 3 to 4 years or 5 years, or more frequently. Suppose, you screen somebody at the age of 40 and you find that you're diabetic or hypertensive, you're a smoker, history of alcohol consumption, etc., overweight, poor, in their diet. Those are the people we need to sort of monitor more frequently. But these are the things which, if we can catch them early, we can actually get changes in their lifestyle and, reduce the chances of them getting heart disease. So it is important and very important that we educate the patient about diabetes. I think diabetes is the absolute number one cause in this country. We are the diabetic capital of the world, and high sugars is definitely one of the things which concerns all of us. So, I find it so strange and so sad that people take diabetes for granted. They say, okay, so what? I will just take some tablets. No tablet, I'll take insulin. It's not like that. Even if you're diabetic and you're well controlled, 50% of all diabetics in their lifetime, more than 50% will have a heart problem. So we need to be very, very careful in screening people. Now, especially as at the age of 40, I said, but also people with high risk to be screened more carefully. If you're a smoker, you're hypertensive, you're diabetic, you've got a poor lifestyle, you're obese, you are under high stress jobs. So these are all the factors which can contribute to heart disease. This is the target population to try and start doing early screening and try to do, as Dr. Rocky has pointed out, use the modifiable, whatever you can modify in the risk factors. It will help them to reduce the burden of coronary disease in this country. Otherwise, we are looking at a very, very high burden of disease in this country, which is going to affect the productivity of this nation. And if we want to improve that, we need to definitely focus on this.
Thank you so much, Doctor. I would like add this in the similar way. I want to ask Dr. Narendra, in the terms like has doctor also mentioned, we all have to start taking care of our health at the age of 40 and maybe after a certain age. But it is is it true that someone who is obese and with a family history and maybe only after a certain age we need to start taking care of ourselves, or everyone should take care of their heart health? What is it like? Is it only them who can get the heart diseases, or is it like everybody who needs to take care of their heart?
As previously spoken by Dr. Sridhar, Mukundan sir, and Rocky, coronary artery disease or cerebrovascular diseases and cardiovascular diseases, they're all interlinked because of cholesterol deposition in the blood vessels, and they're all multifactorial. And it's not that only somebody who is obese will have this. We have seen many lean people, severely diabetic people, they are very lean because they lose a lot of glucose also, a lot of infections, all those things. And even smokers, they are very lean, many of them, what we have seen. And somehow lean people do have coronary artery diseases. They also develop cholesterol deposition and disease process. sometimes more diffuse disease than the obese people. Of course, obese people, especially if they have something called obstructive sleep apnea, there's a correlation between like obstructive sleep apnea is snoring, excessive snoring, where the body won't get sufficient rest. All through the night, they will not get sufficient rest because without their knowledge, they're woken up so frequently. And daytime, they're very drowsy. That also adds up enormous stress to the body physically. And of course, it has risk factors for diabetes also. Apart from that, diabetes, hypertension, smokers, smoking, and tobacco intake in any form, like even what do you call eating this gutka, all those things, that has a major role on the coronary artery diseases, or rather atherosclerotic and cerebrovascular diseases, I would say. In fact, the importance of tobacco causing problems with cardiovascular diseases is less emphasized than the lung cancer, and oral cancer. So it has major role in the affluent society. It's the smoking, and in the common people like lower socioeconomic state, it's chewing tobacco. Tobacco in any form is dangerous for heart. Similarly, above age of 40 years, we definitely need to check regularly. With family history, probably at 35 only, we need to check. Apart from that, somebody who's having a sedentary lifestyle, any risk factors like early diabetes, thyroid problems, smoking. Recently, COVID is another risk factor. All these things we need to check early.
Thank you, Dr. Narendra. Going forward, like understanding, like we all spoken about the various issues, but then there is another factor that how do we change it? What can be a preventive measure to it? Dr. Sridhar, coming to you first, like what are the awareness, like what sort of awareness we can create and bring a lifestyle change in preventing heart disease, any sort of a heart disease?
So most important is to have a risk score for ourselves. Nowadays, there are lots of apps available. I mean, there are some health apps which are there where you can feed the questionnaire, your answers to the questionnaire, and you get what is called a risk score. Now in medicine, every disease or everything is treated as per the risk associated with that particular individual in that particular disease. So if you enter your risk factors, you'll get a score like that. For example, we are speaking, age is a risk factor, genetic predisposition is a risk factor, diabetes is a risk factor, obesity is a risk factor, cholesterol is a risk factor, smoking is a risk factor. So as you keep on adding up the scores for each as 111, you will come to know where you stand as far as risk is concerned, especially after once you are in a middle-aged population. When once your risk score is high, some of the factors are not in your control. Age is definitely not in your control. Your genetic factors are not in your control. Some of the things which are in your control is your body weight, your habits, your personality, your lifestyle, what you are eating, and how you are conducting yourself. So these are some of the things which you can definitely modify by bringing in some proper dietary restrictions to whatever you are doing towards your obesity reduction, physical activity, which is going to be helpful for diabetes control as far as blood pressure control, and also very good for the heart. Checking your cholesterol levels, I mean, adopting certain measures, dietary measures towards that. And if it is not possible, suitably taking medicines, the anti-cholesterol medicines at appropriate time as advised by your physician. And also, if the dietary habits, lifestyle is not getting control of your hypertension and the sugar levels, there are definitely medications. So these are all some of the things which you should look at. And at personal levels, beyond an age, you can't do everything. I think there is a need for you to, let it go. That's very important. You cannot run around. So I think you should take adequate rest beyond some age, because sleeping, it should not be considered as laziness anymore, because everybody needs sleep. Sleep is most important thing. And if you sleep, that is going to rejuvenate the body. So excess sleeping is not going to lead to obesity, as is the common thought. I mean, somebody who is very lazy is going to be obese is not the true statement. Rather, if you don't sleep, you gain more weight. So if you sleep well, that de-stresses your body, de-stresses your mind. I think the amount of time you give to your family, the amount of time you give to rejoice, I mean, relaxation is also part of life. and the restrictions which you put yourself to lead a happy life. Ultimately, a happy mind is going to give a happy body which is free of diseases. These are some of the things which we should adapt ourselves, scoring ourselves on the scale. Whatever is score, you have to score yourself, and you immediately get an answer what all you can do to reverse some of the damages or reverse the risk factors which you have accumulated because of whatever situation you are in.
Thank you, Dr. Sridhara. Dr. Rocky, I want to come to you. Earlier, you were also talking about that younger population in India is much prone to heart attacks, and we have seen a lot of people who have been undergoing a heart attack, and they have experienced all this. And there's another aspect that you also mentioned about smoking as well. So, is smoking also one of the reasons for cardiovascular problems in India? In terms of all sort of smoking in the younger age, also very younger age, like 25, 30, and then in the very in the 40s, 50s as well.
Yeah, so as we know, earlier we used to think that cardiovascular disease is a disease of 5th or maybe 6th decade, but now age is no more a criteria. Even we see young people in their 20s coming with a heart attack, and most common reason for them having a heart attack is smoking. See, unfortunately, there is no safe limit of smoking. It's not like you smoke once in a while, 1 or 2 cigarettes, it is safe for you. Alcohol has a safe limit, but that doesn't mean that you have to have alcohol. But smoking is a complete no. Even 1 or 2 cigarettes can be injurious and can cause heart attack. Depends how your body responds to that smoke. Because smoking has effect on so many organs, blood and everything, that can cause clot anytime and cause this kind of events. So I think smoking is one of the leading cause. Stopping smoking, quitting smoking should be emphasized and should be our topmost priority in young individuals, so that we don't land up in having such kind of cardiac events. Apart from smoking, obviously there are lots of lifestyle habits which has led to early cardiovascular disease. Lack of exercise, the food we take more of high carbohydrate, fatty food, and no physical activity at all. I mean, we are working from home. Most of us people they work from home, so their physical activity is almost nil now. Even if they try to do some kind of activity, 10-15 minutes, it's not enough. We need to have at least 30 minutes of dedicated physical activity every day, if not every day, at least 5 days a week. So we should keep ourselves up for this kind of thing, so that we don't end up having a heart issues. And as Dr. Mukundan has already told, screening at an early age is important. We don't have to wait for any symptoms to come and then we start screening ourselves. I think screening can be as early as 20s also, depending upon what risk you have. If you are a smoker, if you have a family history, if you're obese, you don't have enough physical activity, I think screening should be done as early as 20 years of age.
Riddhi, I think we lost you.
I think you're muted. I think she's muted. If somebody can.
She's muted. I think the video is also frozen.
Yeah, I mean, the connection maybe is an issue.
Yeah, I think she is logged out. Yeah, that's what happened.
Is there somebody else who is also or we could just go ahead. I think we have the we have the set of questions here which they wanted us to talk about. Shall we just proceed?
Yes, sir. I think.
I think the next one is directed to me. It looks like. In what conditions does a patient require coronary bypass surgery? And we see some relatives coming with an angiogram, and they've written their angioplasty, etc. And if you could explain this in later. So, we see a lot of inquiries, from friends, relatives, etc. They're coming with a CD. And I tell them that as far as possible in life, not to just see the CD, but also see the patient. So, we need to put the whole thing in context as to who is the patient, what are his symptoms, and then look at the angiogram. Because we are not treating, we have to remember that we're not treating angiograms, we are treating patients. And you'll find a total different story sometimes with an angiogram. You need to be sure that the patient is having symptoms and the patient is had an adequate trial of medical management and is not suitable for any simpler form of intervention. So, we are very clear, I think, today in terms of whether to have an angioplasty or a bypass surgery. There is not much of, confusion. And, if the patient has a simple block or single or double vessel disease, which is suitable for an angioplasty, we do encourage them that, hey, listen, you are suitable, go ahead with an angioplasty. Now, where do you opt and tell them, no, I think surgery is better, is if you have multi-vessel disease and too many vessels, a lot of vessels needing attention, needing a bypass, and having too many stents is also an issue for them. So we tell them that when you have three or more, you definitely probably it's better to have bypass surgery. But what we also look for is something called, the first thing our eye sees with angiogram is you got something called left main coronary disease. So we have to very quickly, as soon as you see the angiogram, put them into a group which needs urgent attention, and where the group which we can do it in a period of time. The group which needs urgent attention, where you can have a sudden death if you're not operating or offering them some procedure soon, is what we call as left main coronary disease. So that's on the top of our mind. If somebody presents with a tight blockage of the main artery, which is supplying the heart, we tell them, hey, listen, you need the surgery soon. Sometimes we say, get it within the next 12 to 24 hours. You just get admitted and get it done. It's very safe. Sometimes they say, no, I'm all right. But we tell them, see, listen, this is our advice. You got a very tight block of the main artery. If that artery, a small blood clot, as Rocky had mentioned, that sometimes it's just a clot which comes and blocks the artery. You're absolutely fine till even with 90% block sometimes, but then 90 becomes 100, you get a massive attack. And if that involves the main artery, then, you probably will see your name in an obituary column. So those are the patients which we are very clear that you need to have very quick and you need to have urgent surgery. Then we see patients which have got, say, 90-95% blocks, which are also at risk of getting a heart attack. We tell those people also do it soon, especially if their symptoms are very severe, that they have a lot of rest angina. Even at rest, they're getting chest pain, minimal activities, they're getting chest pain. That group, we tell them, get it done quickly. Then apart from that, we look at, a lot of patients who have calcified vessels and which is not suitable for an angioplasty. And we offer them a bypass surgery. Now, sometimes patients have had an angioplasty, and in some small percentage of people, thankfully now the stents have become better and better and better. A very small percentage of people do get blocks in those stents, and we will offer them in a second option to have a bypass surgery. Patients who have got a little borderline renal function impairment, we find bypass surgery is probably good in them. Ladies or women with diabetes, especially with multivessel disease, the data is there that, bypass surgery is probably slightly better in an angioplasty in the long term. And this is something which we have to look at. What we want to do is to give these people a long-lasting solution and not a quick fix. We want a long-lasting solution. Whether it's interventional angioplasty or whether it's bypass surgery, choose the best thing which will give the person a long-lasting solution. And also sometimes patients present with associated conditions like already got a valvular heart disease plus bypass, near bypass, or a hole in the heart and a bypass. So those are the patients we would automatically offer them a bypass surgery. So this is how we would approach, a patient who's brought a CD with an angiogram.
Thank you, Dr. Mukundan, for taking over and telling it in a simpler way, like what are the things, like what is an angioplasty and what are the process one can go under.
So you see, I can have an alternate job as a compere now.
Yeah, thank you so much. And I would like now go to Dr. Narendra regarding the similar, like what are the possible risks of a coronary artery bypass, a graft surgery which is done, and like what are the underlying health conditions that to be taken into account before going under this procedure? Like Doctor, as he was explaining about the other procedures, in this specific, what happens exactly?
Yeah, before I go into what are the complications or risks involved in a bypass surgery, I would like to emphasize or stress that bypass surgeries, even though it's a major, supramajor surgery, they are relatively safe with the present day advances in anesthesia, monitoring, ICU, all other things, in advances in medical sciences. It has become relatively safe. Most of the patients are scared about any surgery, and more so about any heart surgery. It's like many think they're almost on the verge of dying, but frankly speaking, surgeries have become relatively safe these days. Even though they are very major surgeries, they have become relatively safe. So there's no reason why somebody should be really worried about before going in for surgery. I usually tell my patients they're safer on my operation table rather than sitting at home the previous day or in the ward on the bed. Because if something goes wrong, we can do something and save the patient when they are in the operation theater. That's what I tell most of my patients. Now, having said that, it's not a small surgery. There are a couple of risks or complications that can happen to any of the heart surgeries, not only bypass surgery, even other heart surgeries also. The commonest being, first and foremost is bleeding. Because in bypass surgery or any heart surgery, heart is nothing but a pump of blood. So we have to do surgery on the heart and on the blood vessels if there is any leak or any tear that can cause life-threatening bleeding. The second problem is there can be fluctuations in the blood pressures during surgery and in the immediate post-operative period, which can cause low BP. And also, already these people already have compromised kidney functions. So kidney dysfunction is another complications that can happen. Then we have stroke. So kidney dysfunction and stroke can happen with a heart attack also, or even otherwise, similar to the blockages in the blood vessels of the heart, there can be blockages in the blood vessels of the brain also. So stroke is another complication when we are doing a bypass surgery. In bypass surgery, simply speaking, we create alternative pipes to carry blood to the heart muscle. In the city, we have traffic congestions. Instead of breaking open all the roads and buildings in the city, we create a bypass road. Similarly, what we do in bypass surgery, we create bypass roads for the blood to go to the heart. Now, while doing this, while joining these blood vessels to the aorta, the main vessel, there can be cholesterol which is already deposited there, which can get dislodged and cause strokes. The other complications that can happen is heart, because we are doing a surgery on it, it can become tired and exhausted after the surgery in the first 24 to 40 years, what we call cardiac dysfunction, or rhythm changes, because heart is already irritable. It's what you call suffering from lack of nutrition and oxygen. So it has become irritable and tired and exhausted. So any of these things can be life-threatening. Apart from this, at a later date, after 2 days to 7 days, the complications can be lung infections, wound infections, and very rarely blood vessel complications, because we use a lot of monitoring lines, and sepsis or other full-blown blood infection. So these are all the potential complications that can happen during or risks involved in any bypass surgery. And having said that, the chances of this happening with a normal heart is only 1 to 2%. Means out of 100, 1 or 2 can have any of these problems. If somebody is really sick, that can go up to about 8 to 10%. But rest 95 to 98% of them will go home as if nothing has happened. So I would like to emphasize this. Even though we are scared about a heart surgery, not doing surgery is even more catastrophic, or it's a death sentence for them. Now, having said this, before doing a bypass surgery, what we have to look into, as Dr. Mukundan said rightly, we treat the patient, not the disease or the angiogram. So we have to make sure that the patient is fit and fine to undergo the bypass surgery. So we do a battery of tests, including kidney functions, liver function tests, how the bleeding and clotting capacity of the blood is. We see the blood cell count to rule out whether there's any infection, how the hemoglobin level is. Apart from that, we check their diabetes, we check their thyroid functions. And we also do a lot of a battery of tests and scannings to check whether there are any blockages in the blood vessels of the brain, blood vessels of the kidney, hand. We do scannings of the stomach, blood vessels of the legs. All these things are checked before undergoing any surgery to make sure that they're all fit and fine, and if there's any problem, that is dealt accordingly, with the idea that to make the surgery, bypass surgery or any heart surgery, as safe as possible for the patient. So anybody undergoing a surgery, before that, there are a battery of tests we do and take appropriate corrective actions to make sure the patient is going home. Even though I've done a wonderful bypass surgery, if patient has a massive stroke, which we haven't seen, then that's a major disaster for the patient. So there are all protocols now, and set protocols. All these centers do that, and we do a battery of tests and make sure everything is fine for the patient. Over to you, Riddhi.
Thank you, Dr. Narendra. You sounded very simple, but has all the doctors in Bengaluru, you gave an example of traffic as well. So in Bengaluru, the traffic is a problem. And over there, doctors and everyone speaks so simply. So this sounded very simple, but yes, I hope a lot of people have understood the procedure, and we hope that people understand this very well. And as Dr. Mukundan also gave a very a deep understanding, when to go under angioplasty or when to go under a bypass surgery. This is a very important information. To go further, I want to come to Dr. Sridhara. We spoke about this bypass surgery, but what are the other precautions the patient needs to take following the post-surgery? So there are a lot of complications after that. So what should one do after that?
Okay. In fact, I mean, if it is apt if this question is post-revascularization, that will be better, because this will cover bypass surgery also, or this will cover any angioplasty or any other repair which we have done to any part of the heart. Post-operative or post-angioplasty, post-procedure care, most important again is to address the risk factors because of which you went in for that. For example, if you have developed heart diseases because of some risk factors which are modifiable, there is no use if you do not address that risk factors again, because the problem came because of the risk factors. If you do not address the risk factors, your grafts are going to get blocked again. We are already seeing patients whose stents are getting blocked, whose bypass grafts are getting blocked, because the core risk factors are not at all treated, are addressed too. The most important thing, another thing which I am telling you, it may not be sound very pleasing. We never cure anything as far as heart disease is concerned. This is a bold statement, somebody may tell it. We are not removing any blocks anywhere. And native, what God-given things are there in the heart are the best things. Whatever we do, repair works, either in the form of angioplasty or in the form of grafts, are never original. So if in addition to this, if you do not take care of your diabetes or hypertension or smoking or whatever risk factors which caused you the problem, these new things what we are putting, either the grafts or the stents, are going to get blocked again, and you are going to be a heart patient again. So that's why we keep saying, once a heart patient, ever a heart patient. And whenever a heart patient undergoes any surgery or angioplasty, it is not the end of the problem, it is the beginning of the problem. And that is most important, because your treatment is going to be lifetime. Drug treatment wise includes medications, treatment wise includes disease modification in the form of lifestyle changes, diet, exercise, diabetes control, sugar control, or blood pressure control, whatnot. Most important is to stick on to your medications, because post procedures we usually give blood thinners to prevent reblocking inside the arteries, cholesterol medications to prevent reblocking inside the arteries. If you are a diabetic medication, blood pressure medication, and some of the rehabilitation things, lifestyle, we would educate the patient. It is very important that the patient complies with all this, and good compliance in medications and follow up for your heart health, follow up for your risk factors is the only sole way that you can get your heart, which has been repaired, last longer. Otherwise, you are going to be again a heart patient. And it is not easy to keep on repeating the same procedures, because the first procedure is the best procedure, and the ensuing next procedures is not that going to be very simple. It's more going to be more complicated, and the chances of success and a long-term outcome fades away rapidly.
Thank you, Dr. Sridhara. Dr. Rocky, coming to you, Dr. Mukundan also have spoken about the various procedures. Dr. Narendra spoke, and Dr. Sridhar also has mentioned about the post surgery thing. But what are the other non-surgical interventions that can be done apart from when there's a blockage, other than a surgery?
So surgery, apart from bypass surgery, coronary angioplasty is one of the non-invasive, minimal invasive, you can say. It's like without, people are scared about getting a cut over their chest. Angioplasty is one thing which can be done. Usually it is done through the wrist or your groin, done under local anesthesia or in some patient with minimal sedation. Takes around 30 minutes to 1 hour, maybe a little more, depends upon the complexity of the blockages. Pretty safe procedure to undergo to remove a blockages. Usually what we do, we pass the wire across the blockage, try to open the block with the help of a balloon, and to keep the artery patent, we implant a stent so that there is no recurrence. But as Dr. Sridhar told, this is not the end of the story, it is the beginning. That doesn't mean that you have a stent in the heart and you're all okay and you're going to stop everything. Lifestyle modification needs to continue. Your medication needs to continue. Your health checkup needs to keep continuing. So there is a never end situation. Any bypass surgery, any angioplasty, it is not the end of the story. So we need to constantly keep monitoring our health lifelong and not at once.
Thank you, Dr. Rocky. And talking about a very important aspect, that a lot of people here in India do not easily accept the bypass surgery. And how do we increase that, the acceptance of that? And another thing is like a heart surgery among the population, like in entire India. And also the cost of the surgery is not that affordable. Dr. Mukundan, I want to ask this to you. So how can we actually make people understand the acceptance, bring an acceptance in terms of the bypass surgery in India? Also, how can we bring in affordable surgery for people?
So as you know, Dr. Narendra also rightly pointed out, the message needs to go out there that bypass surgery is safe. Today, majority of the patients having bypass surgery is almost like any other general surgery. In fact, we tell them it's like general surgery. We don't go on a heart-lung machine. We don't stop the heart. We're doing the heart, which the heart is beating. And this is the majority of the patients who will probably come in and go home on the 5th or the 6th day with very, very good results. The results which are, outstanding. So the number one message is it is safe for you. And that we have to take out that, element of fear now with better technology, with better, anesthesia, with better support services, both in the ICU and in the ward and things like that. And better monitoring. In fact, Manipal has started this remote monitoring, so we can keep an eye on them even when they go home. So it is safe. Believe me, there is no risk, very, very low risk for the life. Now, where the risk comes is when you have too many comorbids. Now, if you have a patient who is very poorly controlled diabetic, who's hypertensive, who's a smoker, who's obese, and who is, not been looking after himself, and who has got poor heart function, these are the people who we have to be a little bit more cautious, and we have to prepare them. And sometimes, we will have a slightly higher risk in this sort of group of patients. So in our practice, patients with very poor heart function and people with got very diffuse coronary artery disease, which is affecting the entire length of the artery, they are the high-risk patients. But apart from that, the majority of them, if you screen them carefully, if you select them carefully, it is very safe. The second issue is about the size of the scar and the pain, etc. So now we have gone down to minimally invasive heart surgery, and almost all the single valve replacement, if you have a mitral valve replacement or an aortic valve replacement or a hole in the heart, all these patients are being done through a very small incision. If you have aortic valve replacement, you have a very small incision from the top or from the side of the chest. A mitral valve replacement from the right side of the chest, a small incision. And we are also moving towards a bypass surgery, which is being done through small incisions. Just last week, we did a patient who had very poor heart function, and we did a bypass through a small incision on the left side. So that is increasing. And as technology improves and as we get good results with multi-vessel disease, even with small incisions, you'll find that acceptability will improve. And we can tell patients that, listen, that not only it's the size of the scar or the pain, but you can also go home faster. So these are the ways to get it out in the community that it is safe. And in the long term, all the data points to, if you have a good arterial bypass, multiple arterial bypass grafts, you're going to have a long-term result, which is outstanding. If you have the internal mammary artery which is functioning, you see patients, I still see patients operated more than 20 years ago coming back who, are doing well. But as, Dr. Sridhar and Dr. Rocky also pointed out, heart surgery or angioplasty is just a way to get people to improve their life. It is not, you're not curing them. You should not get the impression that once I do this procedure, I can go and do whatever I want. What heart surgery or what angioplasty really does is it helps you to get rid of the angina, which means it helps you to get active. It helps you to improve your lifestyle and helps you to overcome all the factors. Because what happens is when people have angina, they stop walking and they stop exercising, and then things become worse. So if you can get them back to walking, back to exercising, back to a healthy lifestyle, you can get a good long-term result. So this is all we need to convince them. And as far as affordability is concerned, minimal invasive surgery is actually can be made affordable because the stay is shorter, the amount of medicines used is less, the consumables used is less. So actually it can become cheaper. But yes, inflation is there. My advice to everybody, get an insurance, get yourself insured, because that is the only way in the future that we're going to be able to, afford all types of surgery, including a heart transplant or a left ventricular assist device. If you go to the United States, you see people are offered everything from left ventricular assist device, which may cost 40 to 50 lakhs, or transcatheter aortic valve replacement costing over 20, 25 lakhs. So it is costly, but yes, get yourself insured in time, early, and keep yourself insured for your life, because you never know when you're going to need these things.
Thank you, Dr. Mukundan. I want to come back to Dr. Narendra. He wanted to add some points on the post-surgery, what can be done and how we can take care of it. Dr. Narendra, to you.
Yeah, like adding to what Dr. Mukundan said and Dr. Sridhar said, people are really scared about whether they'll be normal or not after the surgery. That's a myth. Of course, compared to angioplasty, where patients go home after a stenting, they go home after 48 hours or maximum 72 hours. After surgery, most of our patients go home by end of 1 week. Means the hospital stay will be around 7 to 8 days. So by the time we send the patient to the room from the ICU itself, they are ready to walk around. And over a period of time, we make them walk around in the corridor. And before discharging the patient, we make sure that they climb 1 flight of stairs. So by the time they come home, they're ready to climb stairs and move around and go for a walk in the park. Now, there'll be some amount of tiredness for a couple of 1 or 2 weeks, which gradually they'll improve because surgery is a major trauma to the body. Having said that, by the end of a week or two, they're far more comfortable taking care of themselves, most of the things. Only thing we avoid, because we have cut the breastbone, we ask them to avoid is lifting any heavy weights in the legs, or rather in the hands. Not to lift weight more than 5 kilos for 2 months until the bone is united, or drive, or bending forward and lifting a bucket. But by and large, by the end of 6 weeks, they are as good as, or probably better than what they were before the bypass surgery. And after 2 months, I don't see any restriction whatsoever for their lifestyles. In fact, we advise all our patients to be more active than what they were prior to the surgery. So we advise them to go for hiking, trekking, swimming, everything. They drive, they can get back to work. And since the heart is new now, it's getting good blood supply either after stenting or the bypass surgery. In fact, their tiredness will be less now. They can do more work and they can be more active physically. So it's a myth that just because they underwent either stenting or bypass surgery, their life is doomed and they're not going to lead an active life. In fact, they'll be leading a better life than what it was prior to the intervention. Yeah, that's it. Over to you.
Thank you, Dr. Narendra. I hope that is a very good piece of advice from all of you to understand what exactly is a cardiovascular disease and what are the various surgeries one can go under, and how simple is that and not a very complicated thing. To end, as we come to an end to this, I would like to ask a last parting note to all of you on this World Heart Day. Starting from you, Dr. Sridhara. Doctor, what would be your message to all the viewers on this World Heart Day to keep their heart healthy, and also what Heart Day means to you?
Okay. So heart, for me, Heart Day is every day. Every day is World Heart Day, because heart cannot stop. All organs in the body, or some organs at least in the body, we can stop, but heart cannot stop. Even brain stops working consciously, at least for the night when we are sleeping. So every day, as far as heart health is concerned, is a World Heart Day. So for me. And another thing, most important thing, what I would like to communicate is, a healthy body comes from a healthy mind. And a healthy mind comes when there is internal contentment, internal happiness. That's most important. Whatever you do in all walks of life, whether it is your profession, whether you are a student, whatever you are, try to be happy and contented with what you have. That causes, take adequate rest, good sleep, rejuvenate yourself, relax. These are most important things to have a very healthy body and a very healthy mind, which translates into a very healthy heart.
Thank you, Dr. Sridhara. Dr. Rocky, your comment.
So, because today we are celebrating World Heart Day, we want to create more awareness among all our people that yes, heart disease is no more an age-related disease right now. Anyone can have heart issues. So early detection and the prevention is always better than having any other problem in future. So early screening, lifestyle modification, these are the important things which we want to emphasize from this small talk what we had today.
Thank you, Dr. Rocky. Dr. Narendra.
World Heart Day is a wonderful occasion to make people realize the importance of heart. As Dr. Sridhara rightfully said, heart can never rest. It will rest once for all, finally. Once it rests, we are put to rest. So frankly speaking, World Heart Day, the importance of it is very important. And most of the time I've seen the problem is either the fear that they might have, why people don't seek advice at the earliest is either they have the fear that something might come out in the investigations or tests, or they are in a denial mode. Both are very dangerous. So my advice to everyone is, don't be scared. Things are advanced far better. Earlier it is treated, the better. It's like the best example most of the time I give my patients is, it's like you are scared of fire and there is fire in the house. Just because you are scared, you're closing the door and sitting in the hall. It's only a matter of time before the entire house catches the fire. It's as simple as that. So the more you deny or avoid going to the doctor, the more the damage. Early intervention saves so many lives and so many complications. So please don't be afraid of a heart condition being shown up in the investigations. Please go. It can be fixed easily at the early time, and definitely after that also you can lead a wonderful life. And I wish all the viewers best of the health, and their family also best of the health. We at Manipal Hospital will definitely take care of you well. So any little doubt, please check it. and let all the investigations come normal, then we are happy and safe. So I wish best of health to all the panelists here, all the doctors here, for their families, and all the viewers. Sarve Jano Sukhino Bhavantu. Thank you.
Thank you, Dr. Narendra. Dr. Mukundan, your take on World Heart Day and one message to all the people to how to take care of their heart.
My message is only two, and let me make it catchy. The first message is get moving. So what I mean is that stop being a couch potato, just get out there and get active. Now, if you're less than 60 years old, forget about just going for walking. Walking is for the above 60 or above 70. If you're less than 60, you need to do something really active. It could be running, jogging, walking, swimming, cycling, or some games. We find that, playing games is sort of very good. So get moving is the slogan for World Heart Day for people, because unless you are active, unless you are expending your energy, unless you are burning adequate calories, unless you're doing a real 30 to 45 minutes every day of vigorous aerobic exercise and some amount of resistance or weights exercise, we are going to be in for trouble, because like every one of the panelists, we all have pointed out that we as a race are prone for diabetes. We are prone for heart disease. And we have small coronary arteries. So when we get heart disease, it becomes very difficult to treat and also presents, quite much earlier. So the slogan is get moving. The second one is get vocal about eating local. Now, let me explain that. We have had a lot of patients whom we embarked on this about 9-10 years ago to move people away from rice and wheat towards our own ancient grains called millets. Next year is going to be the World Year of Millets, going to be announced by our Prime Minister. And we should switch over to millets. So this is what we need to get vocal about eating local. Let's forget about eating white rice and polished wheat and things like that and move towards our own ancient grains. And let me tell you that we have conquered diabetes. We have conquered high lipids with just switching people to millets, a bit of healthy lifestyle, and of course, a lot of exercise. So I think that is the message. Get going from the perspective of exercise and from the perspective of diet. Get vocal about eating local. And unless we do both diet and exercise and lifestyle modifications in terms of stress, etc., we're not going to achieve success in conquering heart disease.
Thank you so much. Just one thing. If you have all spoken about the heart problems, if somebody has a cardiovascular heart problem, what about somebody whose heart is broken? What should they do? Should they also come to you?
Yeah, as Sridhar rightfully said, stress is a major risk factor. Frankly speaking, the fact that you're alive itself is a reason for celebration. Every day is a reason for celebration. Celebrate life. Enjoy life. That's very important.
Thank you so much, all the panelists, Dr. Sridhara, Dr. Mukundan, Dr. Rocky, and Dr. Narendra for participating with us on World Heart Day and talking about the very important part of our body, the heart. And as you said, every day is a heart day because it is beating every day. And we hope that everybody starts taking care of their heart health by doing a regular exercises, making better choices in terms of the food, in terms of the lifestyle, what they are choosing. And I would like to thank all of you on behalf of the ISW Council. And I would like to also thank the Manipal Hospital Group for organizing this session and creating an awareness amongst the people about the importance of our cardiovascular health. Take care of your health, everybody. Thank you so much for joining. Have a good evening.
Thank you.
Thank you.
Thank you for having us.
Thank you. Thank you.